Good morning, ladies and gentlemen, dear colleagues. It is my pleasure to welcome you to the second webinar organized within the Prague Process. Before starting my introduction, allow me to inform you about some technical features of this webinar. Firstly, please go to the interpretation button at the bottom of your screen, choose your preferred language and mute the other language in order not to hear both languages at once. We would like to invite you to submit your questions through the chat function, and you can do so in both English or Russian. We have already received quite some questions in advance to this webinar, and we will try to answer to all of them, or Mr. Muenz will try to answer to all of them following his presentation. However, priority will be given to questions relating to the Prague Process region, but we will also try to address all other questions. Finally, let me remind you that this webinar is being recorded, which will allow us to also share the webinar onto our website for use by other people who cannot be here with us today. My name is Alexander Malev. I am the project manager of the Prague Process Dialogue, Analysis and Training in Action project and a member of the Prague Process Secretariat at the International Center for Migration Policy Development in Vienna. It is a great pleasure to be here with Professor Rainer Muenz. Let me shortly also introduce my team. Ms. Irina Lusak, who will be moderating the question and answer sessions later on, and Ms. Julia Subotska, who is the host of our meeting and shall address any technical issues and problems that you might have in entering this webinar. Since our first webinar was quite successful a few weeks ago, we were advised to promote our webinar to a wider audience. Therefore, allow me to also share a few words about the Prague Process to all our newcomers. The Prague Process is an intergovernmental dialogue among 50 states, namely those of the European Union, but also Schengen states, the Western Balkan states, Turkey, the Eastern Partnership states, Russia, and Central Asian states. All in all, 50 states, and as I said, we have three main objectives currently within the Prague Process, namely our dialogue function, the Migration Observatory, which gathers analysis from throughout the Prague Process region, and the Training Academy, which provides capacity building to the state authorities dealing with migration in our respective participating states. The International Center for Migration Policy Development hosts several such migration dialogues, such as also the Budapest process, the Khartoum process, the Rabat process, or the Euromed migration project in the Mediterranean region. Now, with this being said, allow me to introduce our speaker, Professor Rainer Muenz, who was advisor at the European Political and Strategy Center at the European Commission, giving advice on demography, migration policy, border management, and also Africa to Commission President Jean-Claude Juncker until very recently. Before that, he was visiting professor at the Central European University in Budapest, senior fellow at the Bruegel think tank, external lecturer at the University of St. Gallen, head of the research center at the Erste Group, and much more. I myself had the pleasure to first listen to a lecture of Rainer as a student some 15 years ago, and it's a great honor and pleasure to meet him further on in my career and to have him here in this webinar. To me, Rainer is first and foremost one of the best migration experts and demographers that we have in Austria, but I acknowledge that his fame reaches beyond our state borders. With this being said, I would like to give the floor to Rainer, who will speak for about 40 minutes, hopefully, and then we will move on to the question and answer session. Thank you very much. Rainer, floor is yours.
Good morning, everyone around the world. We have participants from different continents this morning. It's both a great pleasure and an honor to share some ideas, thoughts, and results about the corona epidemic and its impact on migration this morning. And you have a chat function where you can raise issues and questions that we will try to answer at the end of after the end of the lecture. And so let me just walk you through a presentation, some slides that should, give you an idea what we are dealing with and what we are talking about. Let's start with some facts and figures. The number of officially confirmed cases is beyond 4 million globally, and we have 1.5 million people who have recovered or who have been tested but have shown no symptoms, and we probably will reach 300,000 people who have died from the virus as of today, which means that we have a mortality rate which is around 7%. So 7% of the confirmed cases and with the death of the person involved. And it's higher in some countries, lower in other countries. There's variation among countries when it comes to death. But we also have to understand that there is probably many more people infected who have not been tested. So I just want to put this in perspective with other epidemics that we had in the past. About 15 years ago, we had the severe acute respiratory syndrome called SARS, basically in East Asia, with 774 people dying. More recently, we had the Middle Eastern respiratory syndrome during the last 6-7 years, where less than 900 people have died so far. Now we have the COVID-19, also called corona epidemic, which has cost us about 300,000 lives globally so far since the 1st of January, so within the last 4.5 months. We have had HIV/AIDS since the 1980s, so this is over the last 40 years, which has taken a death toll between 32 and 35 million people altogether. And when you go back in history, about 100 years ago, we had a devastating Spanish flu, which took the lives of approximately 50 million people, but the death toll could also have been higher. It is assumed that at that time, about 500 million people got infected globally out of a population at that time that was only 3 billion people globally. But let's not forget that tuberculosis is taking a death toll of about 1.5 million people each year. And this can be said about other infectious diseases. Think of malaria. Now, when you see the rate of infection is the highest in Europe, Western Europe, Southern Europe, and in the United States of America. When we look at infections per 1 million people, we're above 5,000 per 1 million. But we also have high infection rates in Turkey, in the Gulf states, in Iran, and increasingly also on the western side of Latin America. And within other countries of the Prague Process, we see Belarus, Moldova, Russia picking up. So that's all confirmed cases, including those people who have died and people who have recovered. Now, when you look at the more recent developments, you see where is the infection more quickly picking up. This is daily confirmed cases. We see the Gulf states, we see Belarus, we see Russia, we see the United Kingdom, still the US and the western part of Latin America, and we see now a few African countries picking up, including South Africa, Gabon, Ghana. When you look at death, you see that the registered death so far per 1 million people, per 1 million inhabitants has been highest in Southern Europe, the UK, Belgium, followed by France, Sweden, and the United States and Canada, but also Iran, and much less so in other countries belonging to the Prague Process. But we should not forget that not all people dying with or from a coronavirus infection are registered properly, because you need to be tested before you die. If otherwise you do not enter the statistics as coronavirus casualty or fatality. So let's start looking at effects on migration. And I would like to start with short-term effects on labor migrants, so-called expats, and also business travelers. And there you can see that the travel restriction and travel bans that we have seen are heavily impacting migration and return of these people. In late April, we had 167 countries and territories in the world out of the 210 that the UN is counting that had fully or partially closed their borders. This is 93% of the world population living in these 167 countries, a serious travel restriction. And out of these 93%, 39%, so almost 40% of the world population were living at the end of April and in early May in a country that had completely closed its borders to non-citizens and non-residents. This is data from Frontex about what kind of measures had been taken. So whether it's restricted or totally closed, you see a few differences among EU countries. You see almost no differences among Western Balkan countries, where almost everything, with the exception of shipping, has been interdicted or shut or closed. Now, there is certain groups of people who are affected by these lockdowns and by also the travel restrictions, working both in the same way, immobilizing them. And a forgotten group of labor migrants, often forgotten group of labor migrants, is people working on cruise ships. Now, there is no cruise ship active anymore on at the high seas, but there is still about 100,000 members of cruise ship crews who are still on board of these ships and who cannot leave these ships for the moment. We have plenty of labor migrants who are somehow caught in the middle because the country where they reside would like to get rid of them because maybe their jobs have disappeared or they are perceived as a risk. And at the same time, the countries where they come from are often reluctant to take them back because they have travel restrictions themselves. Then we have sex workers. So all the facilities are closed for the moment. In many parts of Europe, sex workers are foreign workers, and it's the same situation that they are trapped here. And then we have plenty of caregivers in private homes who are foreigners in the place where they work, and they also cannot go home and can also not be replaced by new ones as long as we have travel restrictions. Now, whether you have a chance of being repatriated or not does not only depend on the measures taken by the country where you temporarily reside or where you have traveled to, but also by the question whether your own home government is taking measures to repatriate you. And you see that, for example, Germany has already repatriated more than 30,000 people in March and April 2020 with about 150 flights. We have seen that France, 23 of these flights, the Czech Republic 13, Lithuania 2, Latvia 1. But for example, there have been no flights to Romania, to Bulgaria, to Ukraine. So these countries could only repatriate people who just got trapped on the other side of the common border with another country. So this is a geography of recent repatriation flights, and you see that European countries have been reaching out to all parts of the globe when it comes to repatriation of migrants and business travelers and also tourists. By the same token, on the other side of borders, you have people who have a work contract, who would have a place to migrate to, but who cannot reach the destination country because borders are closed and travel restrictions are imposed. And in many instances, there's no trains, there's no flights. So even if the border would be open, there would be no means of transport. So then we have not anticipated or unexpected return movements. For example, there's domestic workers, for example, in the Gulf states, where who are being sent back or who would like to get repatriated because the Gulf states have a high infection rate. So maybe they're also afraid of staying there. But to a certain degree, then the sending countries where they come from are reluctant to take them back, or there's no travel connection currently. We have seen reverse migration flows, people leaving Afghanistan to Iran maybe a year or 2 or 3 years ago, but now trying to go back. So what you see on the picture is Afghan nationals who try to go back to Afghanistan, a movement we have not seen on a voluntary base recently. Then we have seen Venezuelan refugees in Colombia who are trying to get back to Venezuela, for example. And we have seen, here's a picture of Tajik construction workers in Russia. So if the construction site is closed, these labor migrants would like to go back to Tajikistan during the time when they have no employment and no income in Russia. Now, let's take a short look on the effects on irregular migrants and asylum seekers. In Europe, you see 57 states currently do not accept requests for asylum, according to UNHCR, which is about 25% of the international community on the basis of sovereign states. We have much fewer irregular flows across the Mediterranean and in a few other places in the world. In many cases where asylum seekers or irregular migrants have been confined, the detention is suspended, but there's also a total suspension of deportation and repatriation efforts that we are seeing here. I give you here the figures of weekly arrivals from Turkey to Greece, Cyprus, and Italy. So that's mainly Syrian citizens, Afghan citizens, but also Iraqis, Iranians, a few African citizens trying to reach Europe via land or via sea from Turkey. And what you see here is that in recent weeks, there have been almost no arrivals, close to zero arrivals. This is the border between Croatia and Slovenia. What you see normally in the spring is an increase. When you look back to last year, what you see this spring is that there's absolutely no increase in the number of irregular border crossings from Croatia into Slovenia. This is the number of people arriving in Hungary. You see, this is the lowest number in recent months. Last time it has been so low was in the spring of 2017. So this is just 3 examples that show an immediate effect also on asylum. This is the yellow line here gives you the amount of restrictive measures and border closures that we are having, and the blue line gives you the weekly asylum applications in Europe, and you see a reduction of about 85% compared to the first 2 months of 2020. So compared to the beginning of the year, the number of people asking for asylum in Europe is 85% lower today than it was 3 months ago. Now, let's take a quick look at remittances. So the interesting thing is that we also know from historical examples in the past is that when you have a crisis in the place where people are coming from, then usually remittances are going up. And what we see here is that the remittances between the US and Mexico, according to data collected by Bloomberg, have been going up in recent weeks, just as it would be expected. But unlike in other times of crisis, now we have a special case because the coronavirus 19 infection and the lockdown that leads to economic recession and unemployment hits both sending and receiving countries at the same time. And so we will see to what extent this time will be different. What we already see that some remittances are delayed following the closure of branches of remittance providers like Western Union or MoneyGram and others. People could just not walk into a shop and send remittances. And there is also long-term effects on labor migration that I would like to discuss shortly with you. So now we are entering the territory of guesstimates and speculation. What we know for sure is that 2 years ago, in the year 2017, the International Labour Organization, ILO, was assuming that there would be 164 million working migrants, so people economically active and living outside their country of birth. So this is the definition of a migrant in the world globally, with about a third living and working in Europe, and about a seventh or an eighth in Asia and in the Gulf states, and in some other Arab countries, and about a quarter in the US and Canada, so in Northern America here. Now, when we ask ourselves, what is the impact of the measures taken to fight the infection, leading to an economic recession, on the short-term liquidity of certain branches and industries, and on the profitability? And both things can lead to the insolvency of a company, both if you have no cash anymore on your accounts, or if your business turns out to be non-profitable for a longer period of time, which will also then translate into a cash problem. And we see this area is highly affected. It's many retail businesses outside the food industry. It's airlines, but also cruise ships. We have already seen a picture of a cruise ship here. It's other forms of travel and tourism, hotels, restaurants, etc. These are the most affected industries. And at the same time, these are also industries where in many countries there is a high percentage of foreign workers employed. So airlines employ many foreign workers by the very nature of their business in tourism and travel, in many retail businesses. Same is true in the automotive sector. In Western Europe, many automotive workers are foreign workers. The same is true for construction, but the construction business seems to be much safer. Many construction sites have not closed even during the lockdown and are continuing employing foreign workers. So this is a first assessment, which industries could be hit most and where migrant workers could be more or less affected here. So migrant workers in heavily affected sectors getting unemployed in destination countries, or if they cannot move to a new job abroad to which they would have been assigned, remain underemployed in sending countries because of recruitment stops. So the examples are, as we have said, tourism, restaurants, car production, airline, cruise ships, local transport as well. In many countries, taxi drivers, Uber drivers, private bus services depend on migrant workers. The other effect is that low-skilled migrant workers are displaced by the crisis because digitalization takes place, the spread of home office use. So for example, retail sales forces could be replaced by online orders. Facility management becomes unnecessary, or cleaning when offices are not reopened and people stay at home, and usually they would not employ a foreign worker to clean to the same extent as their company would do it. This is a calculation that the Joint Research Center of the European Union has been doing. We give you data on the airline impact. So the blue line here is the impact on passenger traffic of the Middle Eastern respiratory syndrome. 5-6 years ago here, we had a loss of a bit more than 10% of airline traffic at the beginning of this epidemic. And again, I wanted to remind you, less than 1,000 people have died from the Middle Eastern respiratory syndrome. About 20 years ago, we had this severe acute respiratory syndrome, basically in Eastern and Southeastern Asia. And what you see here is the red line is a drop of about 40% of airline passengers. So this is MERS, this is SARS, severe acute respiratory syndrome. And this is the coronavirus effect that we are already seeing with different scenarios, how long it might take. So we have lost about 90% of air traffic over the last 3 to 4 months compared to where we were at the beginning of the year. And this has an impact for people working in airlines, on airports, but it also has an effect on people who are depending on business travelers and tourists coming to their place. And it impedes migrant workers waiting to take up a new job somewhere else, or waiting to go back home if there is no flight connection. Let me quickly give you an idea about educational perspectives. What we know from the European Union is that non-citizens in school, about 25% of non-citizens in schools are ending their educational career without formally finishing it. So we call this early school dropouts, which means you are reaching age 15 or age 18. So you're no longer, there's no longer compulsory school attending, but at the same time, you have not graduated from the last class as supposed, as compared to only 10% of the nationals in the European Union having the same problem, being in the same situation. So about 25% of children with migrant background do not properly graduate from European schools. And this can be because of language issues. It can be because they have entered schooling too late because they came with their parents, or some came as unattended minors. There's various reasons for this, or their parents cannot help them at home because they don't speak the language either. Now, what we see during the coronavirus crisis is that in many countries, in most countries of the globe, schools have been closed. There is only 3 confirmed exceptions, which is Nicaragua, Belarus, and Taiwan, where schools have been kept open throughout the corona crisis so far. And now we have the following problem. According to modeling that we have been doing at the Joint Research Center, you can see that reopening schools is more risky than only reopening work sites or to only reopening leisure activities, because children have the same risk of getting infected, but most children don't develop any syndromes and any symptoms, and so they cannot easily be isolated. And so the risk that children are spreading the virus because they infect each other at school and then bring it back home to their parents and grandparents is much higher than other risks that might be for adults. Now, we have the problem that on the one side, children with migrant background already have difficulties in normal times. In lockdown times, there's a high risk that these children with migrant background will lose even more the possibility to integrate into educational systems and to finish their curricula in a proper way and successfully. At the same time, reopening schools is more risky than other measures when it comes to spreading the virus. Let me finish by just saying that in current times, also the contribution of migrant workers to the economy is becoming more apparent when these people cannot travel and are not reaching their destination countries and their jobs in destination countries. We have a high dependence on migrant workers in many countries on construction sites. So from Lisbon to Moscow, we have many migrant workers working in meat processing and meat packaging. There is plenty of migrant workers working in agricultural business. And in many countries also, there is many healthcare workers who come from a different country. And so when you look at these key workers, you see that on average in Europe, 13% of the key workers are foreign born. So according to our statistics, about 1/3 of all workers can be defined as key workers, which are essential to keep an economy and a society running, indispensable in that sense. And many of these functions have not been closed down even during the lockdowns, like hospitals remaining open, food retail stores remaining open, agricultural production remaining open. And now we see how dependent we are on migrant workers in these businesses. And some countries where it's much less the case when you look at Romania or Poland or Bulgaria. So Central and Eastern and Southeastern European countries. But when you look at places like Germany, Austria, Sweden, Ireland, or Luxembourg, there's a heavy dependence here. And so the corona crisis, lockdown, and travel restrictions are a reminder of these issues. So this is the key workers born in the EU, so they are mobile between EU countries. This is the key workers born outside the EU and coming from a non-EU country. But travel restrictions exist today between EU countries as well as between the EU and non-EU countries. So the effect is almost the same. You see where they are working. So cleaners and helpers have the highest percentage of foreign-born workers. Mining, personal care, food processing, drivers, personal service workers, but also ICT workers, health professionals, to give you the full range here. This brings me to the end of this lecture. Thank you so much for having attended and listening. And we now enter the question and answer session. And over to Alexander.
Thank you, Rainer. You disappeared from the screen, which surprised us, but I guess that was your estimation to hide during your presentation, but now you're back, luckily. Thank you very much. You touched on a lot of different aspects and at the same time managed to stick to the schedule. Surprisingly, I must say. We now have a lot of questions that may allow us to dig a bit deeper into some of the aspects addressed in your presentation. Maybe while we are now receiving questions through the chat function, and I invite all participants to ask questions either in Russian or English. Let me start, as we are an intergovernmental dialogue and of course enhance international cooperation on migration. Let me ask you what you think this cooperation will look like in the future. Do you think that states will cooperate more actively in the midterm, or would you rather foresee that the states will try to address the migration issues on their own in the coming months and years? Thank you.
What we have seen over the last couple of weeks is a renationalization of policies and politics. So international cooperation has been weak. On the contrary, we have seen even competition when it comes to trying to get masks, trying to get covering clothes, protecting clothes for medical doctors, nurses, etc. Competition between Europe and the US, for example, but also between European countries. Also, when it comes to measures, lockdown measures have been implemented nationally, and in some more federalized countries like the US or like Germany or like Switzerland, we also have seen measures taken by one province, but not by the other. So it's not only a renationalization, but we have also seen a relocalization of politics during the epidemic. And at the same time, there are certain issues that countries cannot solve on their own, or provinces cannot solve on their own. So if your own nationals are trapped in another country, you totally depend on cooperation with that country. If you want to import foreign labor from a country, you also depend totally on that country. Or if you want to send your nationals to another country, it's the same situation. So there is many reasons why international cooperation should not only go back to normal, but why it's maybe even more important when it comes to fighting the effects of the corona virus epidemic and to fighting the effects of the lockdown during times of gradual relaxation. And so the Prague Process and ICMPD are well placed to play such an mitigating role because they are not, how you say, a biased party. Yeah, they can come to neutral solutions that are not heavily influenced just by national interest of one country, but they can try to mitigate between these interests.
Thank you very much. Rather optimistic outlook for our personal work here at the Prague Process Secretariat. I will now give the floor to Irina Lusak to moderate through the question and answer session. I see we receive a lot of questions already, and we have still some time. So Irina, please go ahead.
So hello everyone, good morning. I welcome everyone here from my side here. As we received a few questions already ahead of the webinar yesterday, perhaps I start with a few of those first. So one of that is, due to the pandemic, many solutions have been put forward to address the shortage of labor in the regions that are outside of the big cities. For instance, targeted reception of migrants in the agriculture sector. Don't you think it's time to forecast these shortages with a risk forecasting plan, as other epidemics may come our way in the future as well? What do you think about that, Rainer?
Yeah, that's an interesting question. So we know that in agriculture, but also in tourism, many of the jobs are not permanent, because in tourism you have a season, or in agriculture you clearly have seasons. And so the people doing that kind of jobs do not have permanent jobs in the place where they go to. And now the question is, to what extent could these jobs be filled by natives or by foreigners? In Western and in Southern Europe, but also in other places, plenty of agricultural jobs and plenty of touristic jobs are done by foreign workers without permanent residence on the place where they work. And so the question is, could or should they be replaced by nationals? There's two answers to it. On the one side, this would only work if there's high unemployment among nationals, because otherwise the nationals would have other jobs. And this is the situation now. We have very high unemployment all over in Europe, not because of the virus, but because of the restrictive measures taken. And so nationals could replace foreigners. In tourism, for the moment, it's not an issue because there's no travel ban restriction lifted already, and hotels are still closed. But in agriculture, the season is not waiting. And so there is attempts to replace foreigners by nationals. At the same time, in many instances, the foreign workers are paid less than the nationals would be paid, or are less expensive because, for example, foreign agricultural workers in many European countries are exempt from social security contributions because they are not permanent residents. And so employing them is cheaper. And so there is also a wage competition between those coming from the outside, working without social security contributions, and those being hired domestically, where social security contributions would be mandatory and would have to be paid. This also has an effect on food prices, obviously. It's very difficult to plan ahead, because if the next epidemic would come next year, it would totally make sense to plan immediately. If the next epidemic only comes around in 10 years from now, it will be very difficult to assign certain jobs already to certain groups of people 10 years in advance. So you can only do some, foresight exercise and have ask yourself, what have we learned from past epidemics and labor shortages, and how would you act in the future? So you do some kind of a, intellectual contingency planning, but you cannot do a strict forecasting and precise contingency planning when you don't know when the next epidemic is going to hit us.
Thank you very much, Rainer. And that brings me to a question that comes from the audience in a live mode, coming from the Western Balkans, I would assume, because regarding the large number of Western Balkan citizens who work in the tourist sector in neighboring countries, first of all, how do you think and whether it is possible to overcome the consequences of their COVID-19 impact on this year's tourist season? Is there a way, or people should just calm down and sit and wait for the better opportunities to come?
There's indications that border controls will be relaxed in Europe as of June and July. So the spring season is already lost, and it makes no sense to, as a worker in the Western Balkans, to go to a place where they used to work before, because hotels are closed, restaurants are closed. So there is no jobs for the moment. But these jobs might reappear. This will depend upon, on the one side, pan-European decisions to be taken. And when it comes to the lifting of border controls at the external Schengen borders, this is something that the European Union will decide jointly. The Schengen member states will decide jointly. But there's also bilateral agreements between countries. So whether Austrians will be able to travel to Italy, or Germans will be able to travel to Austria, is also subject to bilateral negotiations. We'll see. If there's no second wave of corona infections, so if the infections are not going up again after the relaxation of restrictive measures, then we will have a season that might not be as usual, but there will be touristic activities, and many people will be longing after weeks of confinement and home office to go to other places. If there would be a second wave of infections, then you will see new restrictions coming around the corner. And then there is another question, when will intercontinental business restart? So large numbers of tourists, I don't know, flying in from America or from Asia to Europe. This is something which we don't know yet.
Very good. Thank you, Rainer. Then we have a couple of questions that are of a similar nature, and that they both touch upon their migrants in the shadow economy or in precarious working situations. So one question says, due to the economic recession, do you think that there will be an impact on precarious working situation for migrant workers? Whereas the other question rather asks whether there will be more foreigners after the quarantine measures are lifted in the EU in the shadow economy.
Yeah, that's not easy to answer, but I would say in the short term, there is no additional need for recruitment, neither in the formal nor in the informal sector, because we have a record high unemployment in Europe, the highest since World War II, or since the years immediately after World War II. And many people are not formally unemployed, but they work short time, so maybe 10%, 15, 20%. And so there is a big potential. There's not a big potential for additional recruitment. Now, in the shadow economy, we have, or informal economy, we have people who have been surviving at the place where they are, so they were not sent back, or there was no possibility to send them back. And even countries like Portugal or Spain or Italy have been discussing regularization measures in order to bring people out of the shadow economy. I don't see more business in these shadow economies On the contrary, certain demands could also be lower in the future. So the question is, we have to look at this segment by segment.
Okay.
In my presentation, I've shortly given a short hint, for example, at prostitutes. So there's countries where prostitution is legal, and there's many foreign sex workers in prostitution that were out of business. But in other countries, prostitution is either not regulated or is illegal, but we know that there is still sex workers in the informal economy, and they're in a very difficult situation. Yeah? So I think there's also a health risk related to people in the shadow economy, because if you are an irregular migrant with no access to the formal labor market, you probably have no health insurance, or most likely have no health insurance. And if you are sick, there is a risk of additional contagion, because you might shy away from showing up in a hospital.
Thank you very much. Then the other question that come forward. Regarding the perception of migrants, there are a few questions that are quite similar. First of all, it looks like, according to your presentation, that many migrants are perceived in these economic terms right now. So how do you think this affects migrants' integration if they're only viewed in economic terms as a benefit to the countries?
Yeah, first of all, it's good if migrants are seen as a benefit and not as a burden. And as I have tried to show, in certain key functions, it becomes very apparent, because healthcare workers, caregivers at home, but also retail sales forces in supermarkets and in other food shops are a very visible part of the foreign workforce. And so you can say a higher value can be attributed to them. At the same time, we see vulnerable foreign workers in businesses that have been shut down, so who have become unemployed, and where there might be a discussion whether they should go home or whether they should stay. And this discussion will not disappear anytime soon, because unemployment will stay high during the next couple of years because of the loss of economic demand for labor caused by the corona recession that we see. So the debate will stay on. So there's good news and not so good news at the same time.
And with regard to the residence permits, do you foresee that there will be certain restrictions introduced to issuing those visas and residence permits by the EU countries?
Yeah, the issuance of labor visa to non-EU citizens in the EU has already receded after the financial crisis. The European Union countries were recruiting between 500 and 600,000 long-term migrants, labor migrants, before the financial crisis, so some 15 years ago. And we have many more short-term visa for seasonal and short-term labor. And 5 years ago, we have seen only 200,000 long-term visa issued for the purpose of work. So this had to do with the fact that economies were only recovering slowly. Some economies were only recovering very slowly from the financial crisis 12 years ago. And now we will probably have a similar effect, that there will be much less demand for foreign labor from non-EU countries. But it will also affect mobility inside the EU, because also the demand for foreign labor with regard to the recruitment of EU nationals moving from one EU country to another might recede over the next couple of months and maybe 2 or 3 years. At least this is my best guess.
Then we have a question on the promotion of European measures in developing countries, which clearly says, are European measures to promote perspectives on the ground in developing countries today are even more important than before? So also in terms of the brain drain, there is no brain drain, but development comes their way.
Yeah, so again, there's mixed news. So if Europe is recruiting fewer people from non-EU countries, then there is less of a brain drain. But then the question is this fighting brain drain, or is this just leading to brain waste, meaning that the brains are not properly deployed and employed at home because there's not enough job opportunities at the same time? So the urgency of development aid and cooperation persists. At the same time, there will be a scaling back of economic globalization that we're already seeing. So some economic activities linking richer and poorer countries will be smaller in the future if we see a renationalization of production in Russia, in European Union countries, and in other places, in order to become less dependent on these international supply chains. And there is a political push to become less dependent. This is discussed under the catchword of strategic autonomy. So many European countries, including Russia, have realized that there is a heavy dependence on Chinese production of pharmaceutical products, and there is a push for more production. And the same is true for masks. I mean, in most European countries, including Russia, all masks were imported from China until very recently. And so this deglobalization will have a negative impact on the development of middle and low income countries. Then European countries, including Russia,
we have a little break, so
yeah,
perhaps you can still continue asking your questions in the chat. We have quite some, but Rainer, please.
Yeah, I also wanted to say, because European countries are indebting themselves and Russia is depleting its sovereign wealth fund, there might also be less money available in state budgets for official and overseas development assistance and aid. So there will be competition between the need to redevelop, I would say, devastated economies at home and to give money away to poorer regions in the world.
This is very true. This is very true for many countries today. It's a kind of very difficult decision where to invest in which parts of the economy, and where it's more important to find this finance solutions. Another question with regard to the labor migration, because we already observe how many migrants are being sent back to their countries of origin and they are not remaining in the countries of destination. Can this impact the change of labor mobility policies in the countries of destinations, in particular in the EU, in aiming to attract migrants in their key sectors? What do you think about that, Rainer? I'm sorry, you need to unmute yourself because you muted yourself for a second.
It's important to understand that inside, but also outside the EU, in Europe, each country takes its sovereign decisions when it comes to the recruitment of foreign workers. It's only EU citizens that have the right to go to another EU country. But when it comes to the recruitment of so-called third country nationals, so non-EU citizens, each EU member states, but also Serbia or Ukraine or Russia are completely sovereign and can decide whom they let in. So we're not talking about asylum procedures, we're talking about labor migration. And so these policies have already been completely decided at a national level before the corona crisis and lockdown and restrictive measures have kicked in. And so it's important to see that this will totally depend on the recovery. It will depend on how many people will be domestically unemployed, both nationals, but also long-term foreign residents in these countries. And most countries will give priority to the domestic recovery first, and will try to bring back their natives and their long-term foreign residents back into labor before recruiting from the outside. But again, as I said before, we have discussed this with agricultural worker, there still could be the argument that if foreign nationals coming from the outside will be cheaper, and so it would therefore make sense to import these people despite the fact that you have high unemployment at home. And we have seen this even in recent times in Austria and in Germany. The farmers have been recruiting and flying in people from Ukraine or from Romania to Germany and to Austria to do urgent agricultural business, despite the fact that we have hundreds of thousands, if not millions, of unemployed people, registered unemployed people now in Germany and in Austria.
We have a question with regard to the data. Do you have any data on the impact of the COVID-19 on the flows of highly skilled migrants or university students?
It's obvious, I know this from my own teaching, that university students are not mobile for the moment. So when I do my teaching, there's people from many places in Europe and other parts and the neighborhood who sit at home and who are studying from abroad. So it's clear that this has had a restrictive effect and has reduced that kind of mobility. But that's anecdotal evidence. But as all universities, in many countries, all universities have been closing and all other schools are closed. It's self-evident that so I cannot give you a precise figure, but you can be sure that this affects almost everyone in these countries where the lockdown has taken place.
And then we come to remittances. You had a slide on that, I remember well. And do you think that there will be any implications of the COVID-19 on remittances in the Central Asian countries, and how different are trends during the crisis?
So first, there's lessons from crisis times, earlier crisis times in history. So we can, when we look at remittances, we have data for about the last 20 years or so that are fairly reliable, or last 15 years fairly reliable. And what we had seen, I've mentioned this in the webinar lecture, is then when you had a crisis at home, where people came from, then diasporas and migrant workers tended to send more money back home. But now we have a situation where there is a crisis on both ends, at the sending and the receiving end. Or maybe the crisis is more severe at the migrant receiving end. For example, we have Tajik workers in Moscow. So Moscow is heavily affected by the corona virus epidemic with high numbers of infected people. And there is no infections in Tajikistan, or maybe 1 or 2 people. So Tajikistan is not affected by the crisis, but the Tajik workers are losing their jobs in Moscow to a certain degree, and maybe even want to go back and maybe bring the virus with them when they go back. And so when you lose your job, then you are less likely to send any money back home. You just want to go back home yourself. But in cases where you have an established diaspora, think of Armenians established somewhere. So I mean, Armenia is also not very heavily impacted so far, but this could well become the case because Armenia is between Turkey and Iran, which both have high infection rates, so it's maybe only a matter of time. And there you would assume that the Armenian diaspora in the world will send more money back. So I think the difference is between well-established diasporas that might have economic difficulties where they are, but where there's no question that they would go back to any place because they are permanent residents of the place from which they are sending money from to a homeland which is not their own, but which is the homeland of their diaspora in the larger sense, or whether it's short-term or medium-term migrant workers who are just going back and forth between two countries. So the question is, there's a difference probably between the Tajik diaspora fully established in Moscow and the Tajik migrant workers who come for a project or come for half a year or things like that. And the same is true between other places. I've just taken this example because I was already referring to it in my lecture. So remittances will be higher between established diasporas and affected countries back home. If the country back home is affected, which might not be the case, remittances will be lower if you have short-term migrants who will be sent back themselves and who are losing their jobs.
Now we have a few questions related to humanitarian migration. So could you elaborate a little bit more on the humanitarian consequences of the COVID-19 for migrants and especially refugees, of course, in terms of receiving medical assistance, extra support, and what is the most effective humanitarian support that states can provide for these categories of people?
So in times of shortage of medicine, of masks, of detergents, of whatever, of hospital beds, you can assume that the capacities will first be shared among nationals and that asylum seekers and people seeking humanitarian protection will be second in line. At the same time, if they are in camps or in shabby makeshift houses or tents outside camps, social distancing is very difficult, if not impossible. And so the risk of contagion might be higher in a refugee camp than it is in outside camps. So the question is how to address this. At the same time, we see some, inter alia relief, because the number of new asylum seekers is very low these days. And so there is no fresh waves of people arriving. So the picture is mixed. But I would assume that many countries are not giving this a high priority because there is many more urgencies, perceived urgencies among natives. And many politicians also first, tend to cater to the needs of their voters and not to the needs of foreign nationals at the fringes.
Carmen, well, we had a similar question, but you already kind of interestingly answered that. How is there any way that this social distancing rule can be actually implemented in the reception centers or other sites of collecting and confining people? Do you think that there is any way, or in this situation, in the crisis situation, no country will be looking at that first?
There's it's a possibility. There's a possibility you can lift the confinement. You can transport people to hotels, and it's much easier to enforce social distancing in hotels. Or you could bring people to cruise ships and assign a room to each family, or a cabin to each family, or to each couple, or to each individual if they're alone. I mean, there would be possibilities. The question is whether countries would be willing to do that.
That is true. And another question that is kind of linked to that. Do you think that the European Union could provide a special aid package to the Western Balkan countries that would target specifically the migrants? And I would assume the asylum seekers that many of those countries are hosting right now.
I'm not in a position to speak
On behalf,
on behalf of the Union on that. This is for the Director General ECHO to decide, and countries would have to use their direct channels. So international organizations or also NGOs active in that field should go through these official channels. So the country would have to talk to DG ECHO directly.
We have a gender-related question. How do you evaluate the conditions of migrant women on the labor market? What can be possible cooperation mechanisms between sending and receiving countries regarding the labor migration and specifically the gender kind of part of labor migration during the COVID-19? Is there any idea on that? Should there be any measures that target specifically women in this regard?
I must admit that I have no clear answer to this. I'm sorry for insisting this. The only example that I have been alluding to this is prostitution, where we see that about 85% of prostitution is women and only 15% is men in many areas. But so there will be, I mean, this needs to be taken into consideration, because protective measures like, you say, lump sum payments usually don't reach these groups. And this might also be the case with other women, but also with other male migrants who are either excluded from these lump sum payments or who are not aware of them or have no bank account, and so there is no place where the money could be wired to. So it's a matter of information. When it comes to trafficking, you can say the good news is when borders are closed and there's a complete lockdown, that the trafficking will be much less, so which means migration against your will, trafficking of migrants against their will. And what we knew from scanned data is that women are much more likely to become the victims of trafficking than men. But this will resume as soon as borders are reopened and border controls are lifted. So trafficking is, I mean, there's a collateral benefit from it, but not a lasting one, I would say. Then we have particular vulnerable groups or affected groups, which is caregivers in private home. That's mostly women. And there we have the binary situation that on the one side we have caregiving women who are going back and forth between two countries, who would have liked to go back home already 6 weeks ago, when they have started working 8 weeks ago, and they will have to wait until borders are reopened or their government helps with repatriation. The Romanian government, for example, has been sending a train to Austria that would do an exchange, but only 300 people have been using this. And at the same time, you have female caregivers who would have a job in a destination country, but who are prevented from entering. And this can only be bridged by intergovernmental negotiations. So send an airplane, send a train, put people on special buses that would, I don't know, cross Hungary or would cross through Slovenia when people are coming from Croatia, or would cross Croatia and Slovenia or Hungary when they're coming from Bosnia or from Serbia. To give you examples, this is something that needs to be negotiated at intergovernmental level. Cannot be fixed by the affected migrants, in this case, in particular, the affected female migrants themselves.
Very good. As you already touched upon the intergovernmental part of your talk, I'd like to address a few questions that we received ahead of the webinar. And first came from the Eurasian Economic Union Commission that was related to the effectiveness of the joint efforts to combat the threat. Is there a necessity to change the rules for performing labor activities in various states that form different association integration bodies to develop uniform labor rules, social protection rules, and medical support to foreign-born workers?
Yeah, I can only wholeheartedly say yes. We have, this is an issue that is always around, and it is a question which wage levels apply to mobile workers and to people migrating, which forms of social protections to apply, where is the insurance, where are people insured. We should not forget that this is only applicable to people working in the formal sector of the economy. So irregular labor migrants cannot be reached via such agreements. So then there is more of an issue whether in times of crisis, one should not take efforts of regularizing irregular migrants. Portugal has been doing this in recent weeks. In Italy and Spain, there have been discussions along that line as well. But this is an issue that usually requires intergovernmental consultations. They are lengthy, and so they can only say, you need to do this in good times in order to have good solutions in place in bad times. It's very unlikely that emergency measures will mend such issues at a larger scale. Still, the risk of people not being medically insured and shying away from medical systems in case of an infection is a contagion risk. And this is why underinsured people or people, migrants to whom health and healthcare and public health systems cannot reach out in times of crisis, increasing the risk of contagion. And this is why it's so important to have an inclusive approach to it. But again, as I said, you need to negotiate this in good times. It's because governments have totally different priorities these days than to reach intergovernmental agreements on the mutual recognition of insurances for the moment.
Thank you, Rainer. And then I'd like to also address one of the questions regarding the stranded migrants. As we have witnessed, many migrants have been left without support of their countries of origin, so they couldn't return back to their home countries, and they left stranded somewhere they were employed, for instance, like the Tajik immigrants that you were referring to in your presentation. So what are the policy lessons that country can learn from this particular situation?
That's simple and difficult at the same time. I mean, the simple answer is just countries should either hosting countries should extend their solidarity to these people when it comes to food and shelter, or even access to medical treatment and sanitation. At the same time, rich countries might help poorer countries in repatriation efforts, because as we have seen clearly from this small map of repatriation efforts, you see that the richer countries are doing a lot more than the poorer countries. And this is a question of governmental resources. But it's not only a question of governmental resources, it's also the question whether you have whether you can rent an airplane or not. Now, there's plenty of airplanes for the moment that are staying idle on international airports. So access to trains should be easy. When it comes to trains, you need to negotiate also agreements with the transit countries in between. But so the minimal requirement is to to be inclusive when it comes to food and shelter. The problem of stranded migrants often is they have lost their jobs, their residency permits might be expiring, and at the same time they cannot pay the rent for a room or something like that, or even buy food. And so they get in a tricky situation themselves.
And we have a quite technical question that we received from the World Bank, as I recall, with regard to the methodology that could analyze the impact of the no departure or no returns of migrant workers on domestic employment or unemployment. Do you think that there are any specific data or like administrative data sources that we can take into account to measure those effects? And what would be the implications here?
It's a bit early to do scientific calculations because labor market data are often published with a certain delay, and we would have to take a closer look. And as long as European labor force survey data implied, we have to wait for about 12 months usually till data are available for analysis. But we know from anecdotal evidence, I have already quoted the example of foreign agricultural workers, that there is a possible competition between domestically unemployed people and which could also be of migrant background and temporary seasonal foreign labor when it comes to doing the same jobs. But this is only an example where you can see it. And still we see that many European farmers would rather like to continue employing temporary seasonal labor over domestically unemployed people. First, because they say the domestically unemployed people might lack the training. They don't know how to cut asparagus, or they don't know how to pick fruits. So the quality of the product will be much lower if maybe people with longer years in school, but less qualified when it comes to this particular agricultural job. People would do the fruit picking or asparagus cutting, or taking care of animals, or slaughtering, or meat packing, or things like that. But at the same time, there's also this argument of costs, because temporary labor usually is cheaper than domestically unemployed labor whom you try to bring back into jobs, because temporary seasonal labor usually is not covered by pension insurances, or have only unemployment insurances, but have to rely on health insurances back home and things like that. Same with posted workers, so there is an issue. There's also a certain category of people which have a higher risk of getting infected, which are indispensable, which is lorry drivers. Yeah, so for most restrictions do not apply to lorry drivers, so they can still go from one country to another. But it's slowed down by the fact that there's still border control, so they have to wait in queue and wait to cross a border, for which might have taken them 20 seconds 3 months ago, and now maybe they are waiting 1.5 to 2 hours at the same border station because there's now checks or temperature measures taken and things like that. So their work has slowed down, which also puts additional stress on these people. So it's important not to forget about these key workers who continue functioning and who are doing this in more than one country.
Very good. I'd like to perhaps address a few additional questions and then we stop. One of the first will be about the automation. Do you think that COVID-19 will lead to increased automation of labor markets in order to compensate for the limited presence of migrants?
Yeah, this automation wave has nothing to do with a limited presence of migrants. It has to do with the fact that people are staying at home and have to work from home, but also do shopping from home and do streaming instead of going to cinemas and watch historical I mean, the streaming of historical plays from theaters instead of going to a theater and so on and so forth. Have home food delivery instead of sitting in a restaurant. And so there is a digitalization and automation going on. So it's no wonder that companies like Amazon or DHL deliveries and others, FedEx, are not suffering. On the contrary, for them it's boom times. And certain businesses that have managed to switch from retail shopping to retail delivery via a web shop are also apparently doing not so badly, which means that certain jobs are disappearing or have already disappeared, which you can see in the high unemployment figures, and they will not get back to normal after the post-corona times, but they will be replaced or will not reappear again. And this will have an effect on foreign migrant labor when these old jobs were held by migrants to a large degree. Whereas in construction, these jobs will partly have not disappeared during the crisis and will definitely not disappear after recovery, because the construction remains a manual job. Also, food delivery to your home, it will take still plenty of years till this will be done by robots. But yeah, retail shopping in a shop when nobody comes becomes unnecessary. So companies can close their flagship stores and go to the web shop. And usually that's less labor intensive, or the labor doesn't require any migrants, because the administration of a web shop can be done from a home office in Ukraine or in Georgia or in Armenia or in Uzbekistan or in Belarus.
Basically anywhere. So that is
basically anywhere. Yeah.
Then we have the last two questions that I'd like to address. So some countries deport irregular migrants and reject asylum seekers during the pandemic situation, which might have various consequences, including health problems and human rights violations of migrants, shortage of resources of home countries to accommodate them. What will be the EU countries' policies in this regard in the upcoming months?
There's nothing I can say about it. I only have given you the indication that 57 countries in the world have closed their asylum procedures fully. I've also, there's plenty of reports that the border closures that had already started before virus-related measures, when you think the Greek-Turkish border, Turkish-Bulgarian border, just to name a few, have not been lifted, on the contrary. And so maybe countries have learned something from these border closures in order to become more effective when it comes to keeping would-be asylum seekers at bay. It would mean that transit countries will have a heavier burden. Yeah, so because often people are not asking for asylum in the first country where they are safe, but they want to go to a country where the standard of living is higher. Yeah? So if you leave Afghanistan, there's many countries on the way before you reach Germany or Sweden, where you could have or might have asked for asylum, or you might have tried. But as long as borders were open, or it was easy to get over controlled borders, asylum seekers tended to end up in countries with higher living standards. And this might slow down. This might slow down in the future when border controls are becoming more effective, or when asylum procedures are not reinstated.
And okay, we're taking the very last question that concerns the return and readmission of irregular migrants, in particular of non-voluntary return from the EU member states. Due to the temporary suspension procedures, what key challenges, in your opinion, will be faced by the national authorities when those return operations return to normal or can be pursued?
Yeah, with repatriation, assisted voluntary and forced returns temporarily being suspended, there's a backlog that builds up. So this will lead to a higher number of, people in that situation awaiting return or deportation. So you need more spare capacity to host them. And at the same time, it could be that receiving countries who would have to take them back, which is the original sending country of a particular migrant who is now in an irregular situation in the destination countries, if they are heavily affected by either by the coronavirus infection itself or by economic consequences linked to this, they might become less willing or more reluctant to take people back, because they will argue that this puts an additional burden on their labor markets and on their infrastructure during times of crisis. So there might be less willingness to take people back.
Thank you very much, Rainer. I would like to ask Alexander Maleev to join us, and we are going to close our webinar in a minute.
Thank you all, all Rainer, for your patience and for answering all the questions, and of course also to our listeners. I think we have reached the end of our time, and also I would like to no longer put Rainer's voice under stress. So maybe some concluding remarks from my side. Rainer actually drafted a paper on the future of migration outside the COVID-19 pandemic, which shall be published on our website in the coming days. It addresses some scenarios that might be witnessed in the future. And we might also have another webinar with him after the summer. We shall see about that, depending on whether we will manage to have our usual live events or whether we continue in webinar mode for the coming months. Let me also stress that we will have a series of webinars in the coming weeks. We will have one on Ukrainian labor migrants in the EU and the impact of the coronavirus on their situation on 28th of May. And we are now also discussing to have one on labor migration in the Prague Process region on 2nd of July. Beyond that, I just posted inside the chat our website, pragueprocess.eu, where you can find hopefully a recording of this webinar in about a week. In fact, there will be two recordings, namely one which only entails the speech of Rainer and one full-length video with also the introductory and question and answers part. So, and there you will also have the chance to see the other webinars, both the one that passed 3 weeks ago, but also the upcoming ones. I would like to thank our technician and interpreter for facilitating this meeting. I think the language simultaneous translation worked very well. And yes, please visit our Migration Observatory. Please also visit the ICMPD website, which I also posted in the chat, where you have the expert voice on the corona pandemic and where you will find several very interesting articles and expert opinions on this. And of course, we thank Rainer for all his patience and expertise. It was very interesting to listen to you. We had over 80 participants from all over the world, from the US to the Philippines, but also Africa and the Prague Process region, Thailand, and so on. So thank you all for joining the Prague Process, and we'll be in touch again, hopefully in a couple of weeks. Have a nice lunch and afternoon, and goodbye from us all.
Goodbye from my side and stay safe, yeah?
Stay safe, of course. Goodbye.